Hello, my name is Megan Curry, and I'm an Excelsior student here to do my checkoff for IV Push. Initially, I received my order at the nurse's station, and so I would just double check my patient name, date of birth, and allergies. So I have Renee Adams, date of birth 5/25/78. She is not allergic to any medications. Then I would look at my provider orders. So I have furosemide injection 10 milligrams per ml, 20 milligrams IV push every 12 hours as needed for a weight gain of greater than 3 pounds to be administered over 2 minutes with 3 mLs of normal saline flush before and after. My patient gained 3.4 pounds, so we will be administering this medication. I would perform hand hygiene at this point, and then I would move to the nurse's station or the medication room. Sorry. Okay. So I will adjust my camera down so you can see what I'm doing. So I would start out with my furosemide and I would double check 10 milligrams per ml with my MAR. So I want to give 20 milligrams, so I know that I need to give 2 mLs. So I have double checked that, and the expiration date is good. So that is good to go. I have my 2 flushes. I have my syringe. I have my needle, and then I have some alcohol wipes. So initially, I'm going to perform hand hygiene, and then I will clean off the top of my vial since it is already opened, and just make sure that gets good and clean. 15 seconds. So that's good to go. Then I would take my syringe, and then I can discard this in the trash, and attach that to my needle. Um, Discard that, and then I would uncap my needle, insert into my vial, and draw up 2 mLs. Being careful not to have air bubbles as I'm going to push this via IV. All right, got my 2 mLs drawn up. I'll use the scoop method and recap my needle. Got that good to go to my patient's room. Gonna go ahead and label that. So got furosemide, 20 milligrams and 2 mLs. Put that on my syringe with my medication. Set that to the side. Then I have my 2 flushes. I will waste them down to the appropriate amount, which is 3 mLs per my order. And so got that one wasted down to 3. And now I'm going to waste this one down to 3. Okay, that one's good to go now. So I have my syringes and my one labeled, and then I have some alcohol pads prepared to go to my patient's room. I will clean my hands again before I leave the medication room, and then I will go to my patient's room, and I will just introduce myself. Hey, Miss Adams, my name is Megan, and I'm a nurse here. I'm going to be administering your Lasix or furosemide via IV push. I'll be giving that over 2 minutes, the medication, and then we'll flush before and after. If you have any discomfort while we're doing that, just please let me know. Can you tell me your name? Renee Adams, I'm sorry. Thank you. And your date of birth? 5/25/78. Perfect. Thank you. And are you allergic to any medications? No allergies. Great. Okay. All right. Well, we'll get started with this. And if you have any issues, just let me know. Thank you. All right. Make sure my patient area is private. Pull my curtain, and then I will move back down to my. I'll put my gloves on. Before I put my gloves on, though, I'm going to sanitize my hands. Okay, and then I will move that. Hands are sanitized. Get me a fresh pair of gloves. I got my Mar laying there. That's the piece of paper that you saw me flashing around. Printed that out. So I got my clean gloves on. My patient's identified. My patient also has a name band on, so I can identify her by that as well. I do have the correct patient. So I will start out by cleaning my hub for 15 seconds. Actually, Miss Adams did something wrong. Before I clean your port, I'm actually going to check and make sure there's no signs of inflammation or infiltration. Looks like we're good there. No issues. Okay, sorry about that, Miss Adams. Now we'll get back started again. All right, gonna clean this port off. All right, so we clean that for 15 seconds. We'll start out with our initial IV flush. Um, we'll start out, we'll aspirate for blood return. Looks good. Now we can administer. All right, and that's just our saline, Miss Adams. Perfect. Okay, now dispose of this. Then we'll clean again. Okay, got that for 15 seconds. Then we're going to administer our medication. I will take this cap off, dispose of it in my sharps box, and then go ahead and start administering this medicine. This is your furosemide. I'm going to just push it in over 2 minutes. All right. All right. Miss Adams, have you had a good day today? Great. Lunch good? Good. We do have good food here. That is great. Has your family been to visit you? Good. Good. Just have to give this over 2 minutes, Miss Adams, so it takes a few minutes. A little slow. Glad you've been having a good day. Yeah. About halfway there, Miss Adams. Not having any um discomfort. Good. Perfect. Have to keep moving my watch because my second hand disappears. All right, we're almost there. Need to get an old-fashioned watch. That way my second hand doesn't disappear. All right, good deal. All right, everything go good? Okay, perfect. Get rid of that. Then we're going to clean that port off again. Trash. Clean that for 15 seconds. Good. Okay. Now we'll go ahead and flush this the rest of the way. We'll do it slow too because it's got your medication and your IV line. Mhm. All right. No issues. Okay, perfect. So clean this off again. Okay, got that good and clean. And then I would I'm gonna check your arm here, Miss Adams, and just make sure no signs of infiltration, no issues, everything looks intact. Good deal. I will gather up my trash here, and then I will remove my gloves. I'll clean my hands again, and then I will leave Miss Adams's side rails up. I will leave Miss Adams' side rails up and call it within reach and just instruct her that if she has any issues or any new signs and symptoms, just to please let us know. Um, and thank you.